Hey guys, Tony Maritato here, physical therapist and private practice owner, and in this video, I want to share specifically for practice owners, business owners, my forecast for 2021. I don't know if anybody's interested in seeing it, but I've had so many great conversations with so many of you. I thought, you know what, let me put some ideas together. Let me record it and share it with the world and see if I trigger a response in anyone. But here's the deal. It is December 2020 right now. We've seen insane changes to the profession, right? Huge opportunities have opened up with the current pandemic. Huge challenges have arisen with the current pandemic. And what I love to do, I love the creative aspect of business. What I love to do is look at these opportunities, look at these challenges, try to see where we go as a profession moving forward and how we can create something of value that helps the therapist, helps the business owner, and most importantly, of course, helps the patient, right? So let's take a look at a couple of the challenges. Challenge number one, major changes to payment models. So payers are reducing some fees, increasing others. We need to kind of reassess what it is that we do and how we do it. Challenge number two, the patient. Certainly until the vaccine is available and the virus is under control, patients don't want to be in busy clinics. What used to be medium to high volume now becomes a detriment. Now we can't do that anymore, right? Therapists are looking at controlling how many people are in a physical space. So we couldn't produce the same kind of volume we were able to do before. That means less revenue potentially, less profit. Certainly therapists are being furloughed. Business owners, I as a business owner cannot tell you week to week, day to day, who's going to be in the clinic to work. Because if somebody gets exposed indirectly or directly, they might have to quarantine. Certainly if somebody gets sick, they're going to be out of the clinic from a service provider perspective. But then also, I can't tell you what patients are going to arrive. I can't encourage a patient to arrive if they're not feeling well or if they're having symptoms or they were possibly exposed. So every single day is a guessing game. There's no consistency. I have no idea who's going to be there to treat patients and what patients are going to be there to receive treatment. So these are highly variable factors that we're trying to account for. Opportunities, right? Opportunities are huge. Medicare is covering telehealth services for the time being. Medicare has relaxed supervision guidelines for physical therapist assistants and occupational therapist assistants for the time being. Medicare has sped up the enrollment process time frame. So I've got therapists getting contracted with Medicare in like 2 weeks, where before it might have taken 6 weeks. So there are some huge opportunities on that side. The fact that patients don't want to go into busy clinics now all of a sudden opens opportunities for moving to telehealth, for individual providers who want to provide mobile services. Remember, under Medicare Part B private practice, we're able to treat Medicare beneficiaries in the clinic or in their home. In their home could include in their backyard. And so if a patient wants to minimize exposure, what better way than to have the therapist come to their house one-on-one, be in the backyard for open air, maintain the distance that they feel safe with, or go to telehealth. And of course, we know the frustration with telehealth. It's really challenging to get a person you've never met, never seen, never talked to onto a video console. But if you go to the home first, do an open air outdoor treatment or do something in the home maintaining distance, get them established with that telehealth connection. Now, the next time you follow up, it's easy to get them on telehealth. They're familiar with it, they're comfortable with it. And of course, you know, telehealth now eliminates much of the overhead that we were dealing with either commute time as a mobile therapist or lease liability with a brick and mortar therapist. The other opportunities here. I, as a private practice owner, have struggled to hire staff, clinical staff, for over a decade. But now I have the telehealth opportunity. Now I can hire any therapist in my state or any therapist who's licensed in my state to provide therapy services. I could potentially have the patient come to my clinic, the therapist telecommute into my clinic, and now I can leverage technology the way it was meant to be leveraged to improve access, reduce cost, create a work-on-demand setting. There are just so many opportunities within this new structure coming out. Let's talk about some of the frustrations, because I think this is where the real value in this video is going to come in. What are the frustrations? The frustrations haven't really changed that much. We've got new grad physical therapists coming out of school, and new grad could be 5 years, working for 5 years. They're coming out of school with huge debt loads on their balance sheet. They're paying student loans like crazy. They need to make a reasonable income. We know that we're limited by Medicare reimbursement and other third-party payer reimbursement in a more conventional model. So how do we find a profit margin that makes the risk worth assuming? If I hire a therapist, new grad or otherwise, and they're requiring a certain level of compensation for a certain level of performance, I need to be able to make a profit because I'm assuming the risk as the employer. I have risk of the therapist performance. Heaven forbid they hurt somebody, do something wrong, they get sued, I get sued. I have the risk of compliance. If they don't document well, if they violate HIPAA laws or something else, I have to be responsible. If Medicare comes back to audit those records and says, this is non-compliant, this doesn't hold up to the standard, we're taking this money back. The employed therapist is not the one paying the money back. I, the employer, am the one paying that money back. So I've got to look at a multi-year liability for every one of those dates of services performed by the working clinician. Those are challenging, right? And then, of course, finding a therapist who fits the company culture, who feels good being part of what we are doing, who lives locally, who's willing to come into work, and who wants to work in the environment that we work in, right? So a pediatric therapist doesn't want to work in outpatient ortho for geriatrics. That eliminates a pool of applicants. So we've got these frustrations as practice owners that say, hey, how am I going to find enough profit to make this worth the risk? Then we have therapists on the flip side. Therapists who are coming out of school as working professionals. They don't want to be told what to do, and they shouldn't be told what to do. They spent 7.5 years, 8 years of their life learning how to do what they do. They're independent. They are professionals. We should be hiring them to do what they do best, not hiring them to do what we want them to do. So they want to go out. Obviously, the most opportunity for them is going into business for themselves. But with that, they don't want to do the business stuff. They didn't go to physical therapy school to learn how to bill insurance. They didn't go to physical therapy school to learn how to check benefits and, read compliance reports and create policies and procedures. They went to treat patients. So we have therapists who want to be independent practice owners, but don't want to do the business side of things. We have business owners who are good at the business side of things, but are struggling to find therapists. And so I want to share with you kind of this duality that I think we need to recognize. If I, as a practice owner, can expect a 15 to 18% profit margin on running my physical therapy business, I employ a physical therapist. I know OT, SLP, any discipline, but I'm just using PT. I employ a therapist. That therapist, at the end of the day, I'm going to do the marketing for that therapist. I'm going to do the billing for that therapist. I'm going to do the compliance and admin work and admitting a new patient and handling all of that stuff so that therapist can do what that therapist does best, treat patients. On the flip side, so I'm employing that therapist. I'm expecting about a 15 to 20% profit margin. I assume all of the risk and liability in that scenario. Let's flip that over for a second. Let's say, what if the therapist was an independent business owner, practice owner, but they hired me to run all of the business stuff for them? Instead of the therapist being employed by me, I am employed by the therapist. I am still doing all of the same exact stuff that I was doing historically. I'm still running benefits, verifications. I'm still submitting claims. I'm still doing the billing, the marketing, the patient admissions. I'm providing virtual assistant, services to that therapist, answering their phone calls, booking their appointments. Everything that's involved in running the business, I am doing. The difference is, instead of me employing the therapist and assuming all of the risk of the therapist is employing me, and the therapist is assuming all of the risk associated with their actions. But the price of that risk, or the reward, is that they get to do things the way they want to do things, right? If they want to see 10 patients a week, that's what they do. If they want to see 50 patients a week, that's what they do. They are the ones that are responsible. They have the control. At the end of the day, that is what many therapists want. They want to control their schedule, their time, their passion, but they don't want the headache of the back-end business stuff. And that's what we do well, you do well, others. So where I'm seeing this kind of coming together is just a different perspective. It's okay, so I employ you, I make 15 to 20% profit on the revenue you produce. You employ me, you pay me 15 to 20% profit on the revenue you produce. Half a dozen of one, 6 of the other. And the reason why I think this model is more and more and more attractive today in a pandemic environment, in a post-COVID environment, is because when I would look at financial reports for U.S. physical therapy and I'd watch their breakdown, I've been seeing this trend of, it used to be like 49%, 48% of total revenue going to covering salaries, to 52%, to 56%. I don't know where they are now, but certainly we see this creep as margins compress. The day of a clinic making 40, 50% profit margin is, I've never been alive in that day. And so I would imagine that as our margins compress down, the benefit to being the employer instead of being the employed flips over, and so most of us in business, we're not treating patients. We're in the business of treating clinicians. We're in the business of taking care of clinicians. The clinician takes care of the client, right? So the therapist who works for me today, that therapist is my customer already. I just have the added liability of, if that therapist does something wrong, I'm on the hook. If I flip that around and I say, therapist, you truly are my customer now, I'm going to take care of all this back-end stuff that you don't have a team for. And yes, you're going to pay a premium for it. Yes, you can go hire a billing company for 5%, but I'm not a billing company. I'm a company that's going to provide a comprehensive back-end solution for you. And so now you can do what you want to do and do it the best you can. Because if in 5 years, 3 years, 1 year, you therapists decide you actually want to be a business owner and not a therapist, then you can do it on your own, because you know what? You can fire me. But until then, if you want all the benefits, well, not all, most of the benefits of private practice ownership without the majority of the headaches, this is the solution for you. And you're going to pay 20% for that solution. So that is where I think we are going professionally. I think that is the solution that allows therapists to do what they do best without being employees. That is the solution to allow business owners to do what we do best without being employers. Guys, what do you think about that? Obviously, we need to do another kind of roundtable discussion about opportunities coming in 2021 related to the changes associated with the pandemic. But I just wanted to record something right now. As always, I'll catch you guys in the next video.